And I'm Elizabeth, and we're the Toby twins. Welcome to Twin Talk. Today we are honored to welcome Dr. Toufic Kachaamy to the show. He is a true inspirational figure, a medical doctor, and a cancer researcher.
Carrie Fisher was diagnosed with stage 4 esophageal cancer in 2013. She joins me now to raise awareness on this deadly disease with Dr. Toufic Kachaamy, the medical director of interventional gastroenterology, endoscopy, and innovation at the Cancer Treatment Centers of America in Phoenix, Arizona.
The spray cryotherapy is liquid nitrogen that is put on a special device to be able to spray it inside the body.
So you freeze the cancer cell.
You freeze the cancer. It's like when you have, a lot of people have had the skin cancer frozen. So it's a similar technology. And for now, we use it mostly to improve symptoms. But there's a lot of research that people are doing and we are doing to define who is the best candidate and who benefits the most from this therapy. We're always looking for new therapies.
Right.
In this type of disease, still a big focus is on improving quality of life. And that's kind of the area that I do actively.
Dr. Toufic Kachaamy, thank you so much for your time.
Oh, thank you.
We have a very important question we'd like to ask all of our guests. And that is, what is your favorite type of ice cream?
My favorite type of ice cream is dark chocolate, vegan sorbet.
I've never tried that before.
It is delicious. If you ever come visit me, I will have you try it.
Where did you grow up?
I grew up in Lebanon. Lebanon is in the Middle East.
How was your childhood like?
I had a very good childhood. I had a very loving mother, instilled a lot of values in me, like hard work and honesty. And I grew up in a house with 4 children, and we were very close, and they were my best friends.
Dr. Kachaamy, you earned your doctorate in medicine. What made you decide on this as a career?
The reason I became a medical doctor is to help people. It's a very rewarding career because basically all you do all day is try to help people and make them feel better.
You specialize in something called gastroenterology. What exactly is that?
So my specialty is I help people who have issues related to eating and the digestive system. And it's a specialty that involves doing procedures. I don't know if you've heard of colonoscopy, that's one of the common procedures we do. And upper endoscopy, where we go down with a scope and look at the stomach, and we can look at it from the inside.
I'm joined today by Dr. Toufic Kachaamy of Cancer Treatment Centers of America to discuss his paper in gastrointestinal endoscopy, liquid nitrogen spray cryotherapy for dysphagia palliation in patients with inoperable esophageal cancer. Welcome.
Thank you for the opportunity to be here.
So tell us about where this study came from. What was your impetus to do this study in the first place before we get into some of the details?
I trained with one of the pioneers in this therapy, Alvin Zafas, in the Medical College of Virginia, and he was very passionate about this and instilled it in me. I saw it work in many patients, but unfortunately there were not a lot of data on it. So it was mostly in the level of expert opinion. And as I focused my career on cancer care, I wanted to make sure I incorporate something that I saw work and try to gear the field towards offering patients more options.
Does it hurt?
You mean to have a procedure done? No, we put patients under anesthesia so they don't feel it.
Is there anything you can do to prevent cancer?
Yes. So living a healthy lifestyle means being physically active, avoiding being overweight, eating a lot of fruits and vegetables, and a high fiber diet, and limiting drinking alcohol, and all of these will help you prevent cancer. You can't 100% prevent cancer, but you can decrease the chance of having it.
For many decades, doctors have been trying to find a cure for cancer. Why is this taking so long?
I think the most important thing to realize is that cancer is not one disease. So while people call it cancer, there are so many cancers. So even if you find a cure for one cancer, it doesn't mean it's going to work for different cancers. For example, there's a cancer of the stomach or a cancer of the blood, and most people will call them cancer, but they are completely different diseases.
So, like, if you had cancer, if there's a cure for skin cancer and you have a different kind of cancer that there's no cure for, then the skin cancer won't necessarily help for your cancer?
Correct. So a cure for skin cancer will not cure, let's say, blood cancer. And even when we talk about skin cancer, there are multiple different types of skin cancer. And a cure for one will not help a different type of skin cancer. And that's why it's been so hard, because there are so many different cancers. And when you focus on treating one, it doesn't mean the treatment is going to work for others.
What is the most promising treatment?
So the most promising treatment for cancer now, in my opinion, I think is immunotherapy. Immunotherapy is a cancer treatment that uses the body's immune system to attack cancer. We all form cancers all the time, and the immune system kills the cancer. The cancers that we see are the ones that the immune system could not kill. So immunotherapy has been tried for a long time, but recently they've been more successful at helping the body's own immune system in fighting cancer. And what's promising about that is once people respond, they tend to respond for a long time. And that might be the promising cure for a lot of cancers.
That's amazing. Do you have any favorite hobbies?
I like to exercise, I like to cook, and I like to spend time with my children.
You like to cook?
I love to cook.
Actually, I like to cook too.
I know.
Well, actually, I only know how to cook one thing.
Oh, do you know how to cook?
Well, I'm not sure if it's considered baking or cooking. It's pancakes.
That sounds delicious.
Oh. What is your children's favorite dish that you cook?
The favorite dish that I cook with my children like is a dish made of lentils and rice, and it's called mujadra. It's a Lebanese dish, and my children think it's yummy.
That sounds good, actually. Are you involved in any charities?
Most of the charities I'm involved in center around cancer because of what I do.
If you could share one message with the whole world about your work, what would it be?
We need more cancer research, and for that we need people to donate to charities that support cancer. So we can really conquer this disease.
So please donate to cancer research so we can have a cure for cancer. We'd like to thank you so much for your time.
Thank you for having me.
And thank you for sharing your experiences with us.
It is my pleasure.
Thank you, Dr. Kachaamy. I'm Mariam.
And I'm Elizabeth.
And we're the Toufic twins. Thank you for joining us. And we'll see you next time on Twin Talk! If you like our show, subscribe here, like